These days, hardly a day goes by without a plane roaring its engines overhead. But with the increased number of people flying, 2.75 billion people every year, there are bound to be some medical emergencies that occur. On the ground, medical emergencies are scary enough, even with the help of 911 and ambulances that can be on the scene within minutes. But in the air, there are no ambulances to come help, and no paramedic to load the sick person onto a stretcher and take them away to a hospital. So what happens? Perhaps you've been on a flight where a message like this comes over the PA system. Passengers, is there a doctor on board? But what happens to these patients? In their recent article in the May 30th issue of the New England Journal of Medicine, Peterson et al. Looked at nearly 12,000 cases of airline medical emergencies to figure it out and answer some important questions. First of all, what makes people get sick on airplanes anyway? Are they simple things that don't require much treatment, or more serious things that require a visit to the hospital? Secondly, even if there does happen to be a physician or paramedic on board, what happens to these patients? Does the plane need to divert to a near airport, or can it keep going? And most importantly, does everyone survive his or her airplane medical emergency? We'll be taking a look at their findings for each of these questions, but let's start by examining just how medical emergencies are handled in flight. Now, if there does happen to be a doctor on the plane, he or she is going to be really busy really quickly. So let's go ahead and label this person doctor. So what does he or she have to do? Well, their first priority is to care for the patient, to make sure that they're stable and under control. The doctor also has to think about alerting the pilot whether or not to keep flying, or maybe telling him or her that they have to divert to a near airport. The doctor has to keep in touch with the flight attendants to let them know what's going on and allow them to help in any way they can. And while all this is happening, the doctor needs to formulate a plan to figure out if any treatment needs to be administered, how to make the patient most comfortable, etc. It's really a lot for any person to handle, especially given the fact that many physician passengers had no idea that this is what they were going to be doing just a few minutes earlier. In order to help the physician passengers on board the plane, most airlines contract what's called a communication center, which allows doctors on the ground to communicate with the doctor on the plane and the pilot in order to figure out how to best help the patient and perhaps figure out if the plane has to divert to land early or not. The doctors on the ground are trained in how to handle these special situations on board planes, and so they help out the doctors on board and help the situation go as smoothly as possible. Before we get to the results of the study, there's one other really important thing to address. How did the authors find out their answers? Well, they started by examining call records to the communication center from a subset of airlines over a 34-month period, and in this time there were about 750 million people on these flights. And how common were emergencies? Although it intuitively seems uncommon to have a medical emergency take place on your plane, with so many people flying every year, there are bound to be at least some medical emergencies taking place every day. In fact, over the course of the study, the authors found that this worked out to roughly 11 calls per day. But because there are so many flights operating each day, that works out to roughly just one emergency per 600 flights, or about 16 emergencies per million passengers. So let's look at the data another way. If each one of these boxes represents a flight, the odds of your flight having a medical emergency on it would be represented by turning one of them orange. So let's say this one right here. And if we're talking about the odds in terms of passengers, where all these boxes represent a total of 1 million passengers, a dot representing only 16 of them would be so small you couldn't even see it. Based on this diagram, you might think that medical emergencies are pretty rare, especially since most of us have never been witness to a medical emergency on board an airplane. But because of the volume of air travel, they happen every day. After figuring out how common airplane emergencies were, the authors next wanted to figure out what kind of problems people had. And this was the first question the study addressed. What makes people get sick on airplanes anyway? So let's go ahead and look at the data using a pie chart. You might think that heart attacks or women going into labor would be the most common medical emergencies, and though there were a few of those, there were very few of them. Cardiac arrest represented only 0.3% of the total calls, and OBGYN emergencies were almost as rare, representing only 0.5% of the total calls. Together, they made up less than 1% of all calls to the communication center. The actual most common medical emergency reported was fainting, or feeling like one was going to faint, which represented about 1/3 of all calls, or 37%. Respiratory symptoms, shown here in yellow, were second most common, at 12%. Nausea vomiting, shown here in purple, was third, at 10%. Cardiac symptoms, shown in red, was fourth at 8%. And seizures, shown in light blue, were 6%, which rounds out the top 5. These 5 symptoms together represented over 70% of all calls to the communication center. After figuring out what makes people get sick on airplanes, the authors next looked at what happens to these patients. Do they get better, or do they need more serious medical attention? Again, let's use a pie chart to find out. Of the passengers for whom follow-up data was available, many of them got better with no intervention. About a third of the passengers with symptoms recovered enough that emergency medical services, or EMS, were not required when the plane landed, shown here in purple. Of the passengers who needed EMS support, shown here in white, only about a third of these went to the hospital, shown here in orange. Much has been made about the presence of an automatic external defibrillator, or AED, on airplanes, which can restart a heart that has stopped beating. But the authors recorded that the AED was used only 137 times in total, or in about 1% of emergencies, and all but one of these passengers survived long enough to make it to a hospital. What about the plane? Did the pilots need to divert to a near airport to save the patient? Let's see with another pie chart. Though passengers can be facing symptoms that would be serious even on the ground, the authors discovered that the aircraft was diverted in less than 10% of cases, shown here in blue, while the remaining 90% of flights landed at their intended destination, shown here in green. Cardiac symptoms, possible strokes, and seizures were the 3 most likely emergencies to warrant diverting the plane. To the patients that have the medical emergency, though, they're only worried about one thing: survival. So did most patients survive? As it turns out, overwhelmingly so. Despite the huge number of people flying and the limited and varied medical resources that are available on board an airplane, only 36 deaths were noted in total. Though in-flight emergencies seem like exceedingly rare events, they do happen every day. However, most of these emergencies resolve, or they're treated without disruption to the flight, and fortunately death is extremely rare. Though most of us may never witness, much less experience, an in-flight emergency, it's reassuring to know that the flight attendants, pilots, communication center, and if necessary the physician passenger are all there to help in any way they can.